Good morning, everybody. This is Nurse Eunice with Florida Training Academy, and I am so excited to be with you on this bright and early Saturday morning. Today, we're going to do 100 rapid fire CNA practice questions. And as we do in every video, we'll give you about 10 seconds to receive your notifications before we begin. And I already see some of you all in the chat, so good morning. All right, so here we go. Rapid fire. Question number one. What is another term for a skilled nursing facility? Is it A, hospital, B, rehabilitation center, C, hospice, or D, nursing home? And now I'll give you about 10 seconds to enter your answers in the chat. All right, revealing the answer in 5, 4, 3, 2, and you are absolutely correct. Blessing. It is D, nursing home. A skilled nursing facility primarily refers to a nursing home where individuals receive 24-hour care and rehabilitation services. All right, so our next question. After an elderly patient has a stroke and is discharged from the hospital, where might they go for continued care? Is it A, a subacute care center, B, hospice, C, respite care facility, or D, group home? This one's trying to kind of tricky. It's a term you might not have heard of before. So we reveal the answer in 5 seconds. Let's see what we have in our chats. We have a lot of A's, and also happy Saturday to you too, Lotus. So very good, everybody. Subacute care center. So patients recovering from significant health events like a stroke often go to subacute care facilities for additional support and rehabilitation before returning home. All right, let's go to our next question. Who is responsible for developing nursing care plans? Is it A, the CNA, B, physicians, I know. Good morning, everybody. I'm here in Florida. It's such a beautiful day. It was in the 50s this morning, so we're finally feeling like fall. All right, so let's see what answers do we have if you chose B. Great job. So rationale. Registered nurses are trained to create individualized care plans based on patient assessments, helping guide the care provided. Next, what information is typically included in nursing care plans? Is it A, medical diagnoses, B, doctor's orders, C, patient goals, or D, insurance information? I see a lot of B's. I see 2 C's. It looks like Lily says C. We'll give you a couple of more seconds before we reveal the correct response. All right, so nursing care plans typically include C. Great jobs, Lotus, Lily, Charlene, and Blessing. Great job. Patient goals. So nursing care plans outline patient-centered goals. Remember, it's individualized. So if a patient doesn't receive blood, but we need them to have improved energy levels and less lethargy, that care plan is going to be centered around them. It's not going to include a blood transfusion. It's going to maybe include iron supplementation and fluids. So nursing care plans outline patient-centered goals, interventions, and expected outcomes to guide the care provided by the healthcare team. And you as a CNA you are a vital part of the healthcare team. Remember, you spend more time with the patients, so their goals matter. All right, so which of the following tasks is outside the scope of practice for a CNA? Is it A, taking a newborn's temperature, B, measuring blood pressure, C, filing toenails, or D, dressing a surgical wound? Ooh. Actually, looks like a few of them. 2 of them are outside of your scope of practice, not just one. So for this one, I will accept 2 different answers. Which of the following is outside the scope of practice for a CNA? All right, revealing the answer In 3, 2, and everybody who chose D, you are absolutely correct. However, usually CNAs do not take newborns' temperatures because sometimes those temperatures have to be done rectally, and you all are usually not in the NICU or the neonatal care center. So typically when you deal with pediatrics, you're not dealing with a baby who was just newly born. So for this one, more than likely A is not within your scope of practice, and of course D. But going back to D, wound care is usually restricted to licensed nurses as it requires specialized knowledge to avoid infection and to promote healing. All right, so let's see right here. Which of the following conditions is considered acute? Is it paralysis, Alzheimer's disease, diabetes, or pneumonia? I know, great job. I see your answers in the chat. All right, which is considered acute? It happens all of a sudden. I see some answers coming through. All right, reveal the response in 3, 2, and think about walking pneumonia. So yes, pneumonia is an acute condition. So acute conditions like pneumonia have a sudden onset, but in addition to that, they're usually short term. They're not going to be a long-term condition like paralysis. Whereas conditions like diabetes or Alzheimer's disease are chronic. So if it's longer than 6 months, that's going to be a chronic disease or a chronic diagnosis. Pneumonia is usually resolved within a few weeks. All right, so if a patient has had confusion for many years, this is likely a chronic, is it A, physical disorder, B, psychotic disorder, C, cognitive disorder, or D, palliative disorder? Ooh, let's see. Revealing the answer in 5, 4, 3, 2. Let's see. I see a mix of B's and C's. I know you want to think about their confusion as being a psychotic issue, but that confusion stems from issues within the brain. It is a cognitive disorder. So the answer is C. Chronic confusion over a prolonged period often indicates a cognitive disorder, not a psychotic disorder, such as dementia, which affects memory and thinking. In which of the following areas can a CNA legally work? Is it A, data analysis for research, B, intensive care units, C, environmental health statistics, or D, public health law? Well, 3 of those don't even sound fun. So process of elimination, unless you're a numbers person, process of elimination, which is an area that a CNA can work, can be employed. And you all are correct. Whether you knew it or not, CNAs can work in the ICU. So the response is B, intensive care units. So CNAs can work in various clinical settings, including intensive care units, under the supervision of a nurse. However, when you're in the hospital, they don't call you a CNA. They refer to you as a patient care tech or a patient care associate. So the term is PCT. A PCT performs all CNA duties, but adds skills like drawing blood, performing EKGs. They often work in hospitals or specialized clinics with additional training. PCTs generally have more responsibilities and earn higher salaries than CNAs due to their advanced skills. So CNA in the hospital isn't called a CNA because they need you to do more than what a CNA could do. So the term would be patient care tech. And if you're interested in taking our online PCT classes, go to fltraining.com, click on the online courses, and you'll see information about our online PCT class. So that is a great option if you want to go beyond CNA, but are kind of hesitant to go into LPN or RN school right now. All right, so next question. How does a long-term care facility primarily differ from a respite care center? So long-term care, respite care, what is the difference? A, long-term care focuses only on physical care. B, long-term care provides extended care for residents. C, respite centers only offer outpatient services. Or D, long-term care excludes emotional care. Well, that just sounds wrong, so we know it's not D. What is the difference between long-term and respite care? And I see a lot of B's coming through. Let's see if you are right. And you are. And the nurse goes, wow, yay. All right, so B, long-term care facilities are designed for residents who need ongoing care, whereas respite care provides short-term relief for primary caregivers. So imagine that wife who's been taking care of a husband with dementia now for 6 years. She's been a primary caregiver, and she wants to go out and visit her family members. She wouldn't be able to necessarily put him in a long-term care facility while she's taking this vacation, but she could put him in a respite care center, a short-term care facility, so that she can go away for a few days and just refresh, because it's really hard on caregivers. All right, so in a home care setting, CNAs typically work only under a nurse's supervision. B, only with elderly patients. C, without any supervision. D, exclusively with terminally ill patients. This is super easy. Super easy. That's right, Chiefs. That's right, Blessing and Chrissy. It is A, only under a nurse's supervision. So CNAs in home care generally work under the supervision of the registered nurse who oversees the patient's care plan. And remember the hierarchy. So even though you may be there with an LPN, a licensed practical nurse, the registered nurse oversees the work of the LPN and the work of the CNA. So that's why it's always going to be that your supervisor is the RN, not necessarily the LPN. Right, so who are the primary recipients of hospice care? A, children with genetic disorders. B, individuals at the end of life, regardless of age. C, young children needing surgeries. D, elderly patients. Looks like Regina was fast with this one. And Chrissy, I see the correct responses. So everybody else revealing the answer in 3, 2, and believe it or not, there are pediatric hospice centers. So the answer is B. Hospice is for individuals at the end of life, regardless of age. So hospice care is more like a philosophy. Hospice care provides comfort and support for those nearing the end of life, focusing on quality rather than curative treatments. All right. Medicare is a healthcare program primarily for A, homeless children, B, programs that provide food to the elderly, C, low-income individuals, or D, government-funded healthcare for certain groups. Yes, as a CNA, you got to know about Medicare, Medicaid. You're going to hear all of these terms, and I need you to be a little bit knowledgeable. So, what is Medicare? I'm doing my nurse dance. Lotus, Hayon, Maud, Darlene, Chrissy, Karen, great job. It is D, government-funded healthcare for certain groups, not just for the elderly. So Medicare provides health insurance mainly to those age 65 and older and to some younger individuals with disabilities. CNAs are not allowed to apply which of the following? A, antibiotic ointment, B, blood pressure cuffs, C, body lotion to feet, or D, denture care. Yeah, Chief says, yep, listen to it all month. Yep, I think it's open enrollment. So yeah, you're going to hear all the Medicare commercials. All right, so CNAs are not allowed to provide which of the following? And Tamika, Roja, Claudine, Lily. Oh, so many of you are. Nardos, Joy, Jerlyn, Chelda, you all are right. It is A. You all cannot apply medications. It is antibiotic ointment. So applying medications, including antibiotics, is outside the scope of practice for CNAs and requires licensed personnel, because we will, if we allow you to, apply antibiotics to everything, even if it's a fungal infection. So you need somebody who is licensed to go and assess that particular infection. Because if we apply antibiotics to a fungus, well, we're just going to cause an overgrowth of the fungi. So it's really important that you just don't self-treat, that you allow the nurse to go in and to perform the job, do her assessment, and then she will notify the doctor. Next, after completing tasks such as emptying a drainage bag, of course, the drainage bag with urine, what should a CNA do next? A, record that the task was completed. B, notify the family members. C, report directly to the medical center, a medical director. D, disconnect the catheter tubing. All right, let's see. I see so many correct responses. It is A. You're going to record that the task was completed. So documentation is essential for all completed care tasks, helping ensure continuity of care and communication with the healthcare team. But what are you documenting? You're documenting the quantity. How much urine did you empty? The clarity, was the urine cloudy or clear? The color. So this is what we mean by the continuity of care, because if we find that there was not a significant amount of urine in the bag, that means that your patient is probably dehydrated. So your doctors and your nurses actually do go back and review the information, the numbers that you put in the system to help guide the patient's care. All right, so where can CNAs find a list of tasks that they are legally allowed to perform? Is it A, state laws and regulations, B, federal laws only, C, nursing home policies, or D, medical board guidelines? And this is important as a CNA, but it is extremely important once you become a nurse, especially if you're a traveling nurse, because what they allow in one state, they may not allow in another. So that is my hint. And Hayon and Dorvillier, yes, and Lotus, you have it. Even as a CNA, it's not that facilities policies that that's nice to know. But the facility may be having you do something that is not within the state's guidelines. So you always want to know the state laws and regulations regarding your professional license, because the scope of practice for CNAs is regulated at the state level. So specific state laws outline the permissible task, which is why when you ask us questions about how many answers or how many questions on the test, if it's just basic knowledge like what I'm teaching you now, that's pretty much national knowledge. But when it comes down to skills, we have to be careful, because every state may do something a little bit differently, and we don't want to misguide you. So look at your state laws so that you know what's required in your state. Which of the following tasks can a CNA perform legally? All right. Is it A, provide wound care for pressure sores, B, measure blood pressure, C, insert a urinary catheter, or D, administer medication? Which of those is a task that a CNA can perform? And this is so easy. I'm not giving you any extra time, because you all should know that the only task listed here that you can perform legally is B. Great job, team. CNAs are trained to measure vital signs like blood pressure, but tasks like wound care, inserting catheters, and administering medication are outside of their scope of practice. Yes, there are additional classes you can take. Yes, when you become a CNA and you work in a hospital, they call you a patient care tech and they teach you how to insert catheters. But that is not the case when you are taking your initial CNA examination. You are not allowed to do anything invasive nor give medications. Right, so next, when documenting care, a CNA is responsible for recording A, the care that the nursing team provides, B, all patient diagnoses, C, only the care they provided, D, medication administration. What are you responsible for? Oh, if you all could see my smile as I see so many correct responses come through. Yes, you're only responsible for what you did. So, only the care that they provided, they being the CNA. So, CNA should only document the care they personally provide to ensure accurate records and accountability. When a CNA measures urinary output, where should they document it? Is it A, intake and output or INO form, B, nurse's notes, C, doctor's orders, or D, patient's chart? I'm so proud of you for getting up bright and early with me on a Saturday morning and studying. So many of you all are passing. You all make me so proud. And this one, I know that everybody got it right. Everybody chose A, the INO form. So urinary output is recorded on the intake and output form to monitor the patient's fluid balance. Remember, if they have too much going out, nausea, vomiting, diarrhea, they're going to become dehydrated. If they have too much going in on top of having kidney issues, where if they're not urinating, they're going to become overhydrated, or we call that being overloaded with fluid. And that's when their lungs start rattling, their legs start swelling. So we want to keep a normal balance. What goes in should match what comes out. No excesses and no deficits. Next, after taking a patient's vital signs, the next step is to write them on a piece of scrap paper, call the family members, document them on the vital signs form, or D, report them to the doctor. I know what you do in the real world. What you do in the real world is not the correct answer. So, what are you supposed to do? Yes, Nardos. Yes, Jutna. Yes, Darlene, Vivian, Lotus, Sherlyn. You are absolutely correct. You're supposed to document them on the vital signs form. So it is C. Vital signs should be documented immediately on the appropriate form for accurate record keeping and communication. I know that is not real world. I know in real world you have 12 patients. You write it on a piece of paper, and then when you get time, you sit down and you enter all the information into a computer or you put it in the patient's chart. But when you're taking a test, that is perfect care. Perfect care, not real world. So perfect care would be as soon as you complete your vital signs, you will go to a computer and enter the information electronically, or if they still have a paper chart, you will write it in the documentation section. Right. Which professional would help a patient with swallowing difficulties? Is it A, speech therapist, B, physical therapist, C, occupational therapist, or D, social worker? Yes, Vanessa, you follow the care plan, and we say nurse's order, but the nurse gets the order from the doctor. So I would need clarification on what you mean by the nurse's order. Maybe it's the verbal. Once the nurse has read the order from the doctor, and then she gives you a verbal order. Maybe that's what you mean by nurse's order. But yes, a CNA would have to follow both. All right, I see a lot of correct responses. You all know that a speech therapist specializes in treating swallowing and communication disorders. If a patient who recently failed is now receiving balance exercises, which professional is likely helping them? Is it A, social worker, B, occupational therapist, C, physical therapist, or D, respiratory therapist? And hi, Mila. I thought about you the other day. I've not done a live again on Zoom. I was thinking about doing one of those games again. I forgot what you call it. I'll think of it in a few moments. So anyway, I definitely thought about you. So good morning. All right, everybody. Let's see what the correct response is. If you chose C, you know that a physical therapist focuses on exercises and therapies to improve mobility and balance. Next, who would most likely assist a stroke patient with adaptive devices for eating? Is it A, occupational therapist, B, physical therapist, C, speech therapist, or D, social worker? It's a beautiful morning. All right. I'm revealing the answer in 3, 2, and ding, ding, ding. A lot of you all got it right. It is a occupational therapist. Occupational therapy, if you haven't thought about that as a career, that is a wonderful career too that will allow you to have stability without necessarily doing all the hands-on stuff that nurses and CNAs have to do. So anyway, occupational therapists work with patients on daily activities and may provide adaptive devices to assist with eating and other tasks. So, if you had a stroke or maybe an automobile accident, they're going to teach you how to write again, how to use an extremity that may be constricted or restricted due to your lack of range of motion. So, occupational therapy is also a wonderful career field that you should probably, just go ahead and look it up, investigate it to see if that's something that you could do. But you can work with children and adults. So I love occupational therapists. Shout out to our OTs. All right, so when a patient is being discharged from the hospital, who often assists with planning their discharge? So you did such a great job. Mr. Joe's about to go home, but who did all of the planning? Is it A, the registered nurse, B, the occupational therapist, C, the social worker, or D, the dietitian? And why is this important? Because you are working with a healthcare team and you don't want to be talking to the wrong person about the wrong situation. So you have to know what everyone's role is. And so for this question, if you chose C, great job. You understand that the social worker, not the nurse, the social worker is responsible for coordinating discharge planning and helping to connect the patients with the resources they may need post-discharge. So if a patient's going to rehab, the nurse doesn't get on the phone and make all of those calls and those connections. The social worker does. And the new term for social worker is case manager. Where is restorative care typically provided? Is it A, acute care hospitals, B, hospice care, C, respite centers, or D, rehabilitation units? Good morning, Vanessa. I'm sorry you got woken up by the trash collector this morning, but I'm happy you joined us. So, we're gonna be positive today. You woke up early just to be here with us. So welcome. All right, everybody. I see the correct answers. Yes, yes, yes. It is D. So let me say the term correctly. Restorative care. You're trying to restore someone, bring them back to whatever their previous level of ability was, or improve their previous level of ability. Restorative care is done in D, rehabilitation units. So rehabilitation units provide restorative care to help patients regain independence and improve their abilities after illness or injury. Oh, you all, we have 100 questions. So we're going to be here for another hour, but I appreciate you. So in a patient-centered care model, who is the focus of the healthcare team? Is it the stockholders, the hospital, the patient, or the nurse? Who is the focus? All right, I'm revealing the answer in 3, 2, and yes, it is D, the patient. The patient is the focus. So, patient centered care prioritizes the patient's needs, preferences, and values as the central focus of the healthcare delivery team. If a nurse assigns you to empty a patient's urinary drainage bag, what should you do? A, refuse the task as it's not a CNA's responsibility. B, disconnect the catheter tubing. C, complete the task and report it to the nurse. D, keep the tubing before emptying the bag. What do we do? What do we do? And I see that all of you know that the correct response is C, complete the task and report it to the nurse. Normally, we don't go up and it's like, hey, if I tell you to do something that you're supposed to do, you don't come back and tell me you did it, but you would just document what the output is. But for this test question, that was the best response. So emptying drainage bags is within the CNA scope of practice. It's essential to complete the task and communicate with the nurse for continuity of care. But in the real world, you got 13 patients. Just do what you're supposed to do and document in the computer. And if you happen to see the nurse, you're not going to go out your way to go tell the nurse, hey, I emptied the drainage bag, because the nurse is like, that's your job. Thank you for doing your job. You only tell the nurse if there was something abnormal that occurred when you were emptying your drainage bag. But again, for this particular test question, that was the best response. Okay, so what is the primary goal of restorative care for a teenager recovering from an accident? Is it A, ensure they keep up with schoolwork, B, help them regain full and normal function, C, prepare them for long-term hospice care, or D, maintain their airway? And because we just talked about this maybe 10 slides ago, I know that you all are going to select the correct response. And don't forget that as a CNA, you just don't work with older adults. You work with everybody. So you can work in the pediatric hospital, you can work in the jails, you can work in clinics, you can work in elder care. And so for this one, the response is going to be B. You're going to help them regain their full and normal function. So restorative care aims to help patients recover their abilities and resume normal activities as much as possible after an injury or illness. Teamwork. You have to learn how to work with people. Teamwork in healthcare requires A, equal collaboration among all team members, B, the doctor to lead the team, C, the nurse to lead the team, or D, constant supervision by a senior staff member. Vanessa, Darilia, Yuri, Yolanda, Lotus, you got it right. It is A. Let me tell you, a good CNA will save your license. It will save a patient's life. So when a CNA tells me something, I don't care how busy I am, either I'm going to explain why I am not that worried, or I'm going to get up, stop what I'm doing, and go see what that CNA is talking about, because effective teamwork in healthcare involves all members collaborating to provide the best patient care, respecting each other's contributions. So if you're a nurse who doesn't listen to your CNA, you are putting your patients in danger. Get up, check it out, and if they need further explanation or education, you provide that in a loving manner. Next, you all, what is a characteristic of a good team member in healthcare? Is it A, focuses solely on their own task, B, avoids communication with others? Oh my God, I don't like working with those people who don't talk to anybody. C, takes responsibility and is accountable, or D, prioritizes personal gain over team success? Imagine being on a 12-hour shift and your coworker never talks to you. It's just like they're just doing their job. I'm just here to get paid and do my job. That makes everybody uncomfortable. So for this one, I hope that you chose C. You want to take responsibility and be accountable. So good team members in healthcare accept responsibility and accountability, which helps the team function smoothly and safely. And you have to communicate. You have to talk to people. So if you're not a people person, work on a computer. A sign of success within a healthcare team is when A, conflicts are viewed as opportunities for growth. B, mistakes are punished severely. C, negative emotions are never expressed. Or D, team members avoid taking risk. What is a sign of success? So you and that CNA who never get along, she's just mean and rude and she mistreats you. Are you just not going to talk to her? are you going to have a conversation with her and work out your conflict? So the answer is A. Christabel, I'm going to have to block you. No one listen to whatever Christabel just said. Let me see. Let me block her now. You're in timeout, Christabel. All right, so there we go. A, conflicts are viewed as opportunities for growth. So successful teams address conflicts constructively, seeing them as a way to improve communication and teamwork. Next, in a care conference, who is most responsible for the patient's care plan? Who is most responsible? Is it A, the patient, B, the nurse, C, the doctor, or D, the CNA? All right, I'll be revealing the correct response in 5, 4, 3, 2, and the person who is most responsible for the patient's care plan is going to be the nurse. I know that was tricky. It's like, is it the doctor or the nurse? The doctor gives the orders. He or she will diagnose the patient, and the nurse then, along with the patient, works on the patient's goals and based on the patient's condition, creates this plan of care or this care plan. And then once the goals are listed, the CNA, the nursing team, the respiratory therapist, etc., we work together to help make sure the patient reaches those goals. However, not all goals will be accomplished during a hospitalization. So we try our best, but we can't do everything. So the nurse typically leads the development of the care plan, incorporating input from other team members to ensure that the patient's needs are met. Who should attend a patient's care conference? Is it A, only doctors and nurses, B, only CNAs, C, the entire healthcare team and the patient, or D, only the patient's family? So, a patient care conference is a big term for something that is not big. It's a meeting about your patient. Notice I said your patient. So, if it is your patient, I need you there too. So, the correct response is going to be C, the entire healthcare team and the patient. So, great job, everybody. A care conference includes the healthcare team, the patient, and often family members, ensuring all aspects of care are discussed. When documenting, a CNA is allowed to record A, all patient care, including doctor's orders, B, only the care they personally provided, C, diagnoses from the doctor, or D, lab results. And we already discussed this one earlier on this practice test, so this should be super easy. And I'll reveal the correct response in 3, 2, and yes, Adiola, it is B, only the care they personally provided. CNA should only document their own care tasks to maintain accurate records and accountability. All right, Vanessa, you're funny. All right, so everybody, which healthcare professional would most likely work on a patient's gait and balance? That means you have to know what gait means. Is it A, physical therapist, B, speech therapist, C, respiratory therapist, or D, occupational therapist? Yes, Renata, Jerlyn, Yuri, Jessica, Chrissy, Heyon. It would be a physical therapist. They specialize in improving movement, gait, that's how someone walks, and balance for patients with mobility issues. The primary role of a speech therapist in healthcare is to A, provide translation services, B, teach patients how to walk post surgery, C, help patients regain hand strength, D, improve a patient's swallowing and communication abilities. Couldn't trick any of you all, so I'm going to the next one. Yes, everybody, it is D. Next one. Oh, this one's a scenario. I love scenarios. So here we go. Mr. Turner is an 84-year-old male who has recently suffered a stroke. leaving him unable to perform basic activities of daily living or ADLs, such as bathing, dressing, and preparing meals. He expresses a strong desire to return home despite his physical limitations and the safety concerns raised by his healthcare team. Please use this scenario to answer the following questions about Mr. Turner. Mr. Turner's home needs modifications to accommodate his physical limitations. Which of the following home modifications would be most helpful for his situation? A, installing a grab bar in the bathroom. B, placing decorative rugs in the hallway. C, adding a TV in his bedroom. Or D, rearranging furniture to make the living room more spacious. Oh, I love you all. You are ready for home care. And Darlene, you're not wrong. But to make it more spacious, if it would have said to give him a clear area to walk, but just to make it more spacious isn't the correct response. So, everybody, the best response is going to be A. Installing those grab bars in the bathroom enhances safety and reduces the risk of falls. Decorative rugs can pose tripping hazards, and while comfort measures like adding a TV or rearranging furniture may be appreciated, they do not directly address safety or accessibility. We're continuing with our scenario on Mr. Turner. If Mr. Turner is discharged home with the support of home health services, which task is outside the scope of practice for a CNA? Is it A, assisting Mr. Turner with bathing and dressing? B, administering prescribed medications? C, observing and reporting changes in Mr. Turner's condition to the nurse? Or D, helping Mr. Turner with light housekeeping tasks? And I did a video, I think like 2 weeks ago, with the VP of Senior Helpers. So don't forget that as a CNA, in addition to working in hospitals and nursing homes and clinics and pediatric hospitals, you can also work in the home care setting and get paid a decent amount just to take care of one deserving client. So if you chose B, you understand that CNAs are not licensed to administer medications. Their role includes assisting with ADLs, observing and reporting patient conditions, and supporting a clean and safe environment. What CNAs can often do in the home is provide medication reminders. So the nurse or the family has already put all the pills in a pill minder, and you are to remind Mr. Lucas that, hey, it's almost 9 a.m. in the morning. Let's go ahead and take your medication. You can hand him the pill container, but he has to physically touch his pills. Right. So an OSHA survey in a healthcare facility focuses on A, CNA certification, B, patients' rights, C, nursing licensure standards, or D, health and safety practices in the facility. You have to know so much as a CNA. Oh my God. What's OSHA for? Who's OSHA? Who's JACO? And everybody got it right. OSHA is safety. So D, health and safety practices in a facility. OSHA surveys ensure the facility follows health and safety standards to protect both workers and patients. For example, making sure that sharps are placed in the biohazard bin or sharps container and not in a plastic bag where that could cause a danger to someone who picks up a bag. So when you think of workplace injuries and prevention, think OSHA. In a long-term care facility, the people receiving care are often referred to as, is it A, patients, B, clients, C, consumers, or D, residents? Revealing the answer in 3, 2, and you all have it. They reside there. So they are the residents. They are not patients. So, in long term care facilities, individuals receiving services are commonly called residents, as the facility often becomes their long term home. And so, Shani, I passed the CNA again. You are so welcome. If your CNA has lapsed, then keep studying. Thank you so much for that confirmation, and I am so proud of you. Everybody, please congratulate Stylish Shani. All right, so most of the care provided at an assisted living facility or ALF is delivered by A, physicians, C, registered nurses, or D, physical therapist. Someone wrote me the other day and they said that they were previously a dental hygienist and that they were tired of being in that field and that their mom encouraged them to challenge the test. In Florida, you can challenge the CNA exam, and there are like 4 other states that you challenge the exam. And she never attended a class. All she did was watch our videos, our practice question videos, and our skills videos. And she wrote me back to let me know that she passed her exam and she's now officially a CNA. So you all, it's not hard. Those facilities, once you have your license, they're going to train you the way they want you to be taught. So, don't be so hesitant. It's like, oh, I don't have enough hands-on experience. You will get the experience. We just need you to be a safe provider. And that competency test that you take before you become a CNA, that determines that you have the base knowledge, because it is consistent of a written or a computerized portion and a skills portion. So if you can pass the written test and you can pass the skills, you get your license, and that's when you can go off and work in your nursing homes, hospitals, etc. So I don't care how you start, as long as you start, but I am glad that you're here with me today. So for this one, it is B, personal care assistants. So personal care assistants provide most of the direct daily care in assisted living settings, helping residents with basic needs. So in other words, assisted living facilities don't have to necessarily have CNAs. They can have somebody who is unlicensed. They're working as a patient care assistant who can also provide care. But do know that if you're not licensed, you're not going to have the credits needed to have more preference whenever you're competing for the nursing program, and you're probably also not going to get the higher pay. But if you just want to get in, you can get in as a PCA. Next, which of the following is an important sign that a patient may be experiencing silent aspiration? Is it A, coughing or choking during meals, B, complaining of difficulty swallowing, C, a sudden drop in oxygen saturation with coughing, or D, vomiting after eating? Yes, we'll be praying for you. Also, all of you all have tests coming up, or if you don't have tests coming up, at least you're thinking about, can I pass this test? And I'm here to tell you, and Shawnee's here to tell you, and thousands of other people who've watched our videos are here to tell you that yes, you can pass your test. So everybody, revealing the answer in 3, 2, and 1. What is silent aspiration? It is C. So I'm happy I was able to teach a lot of you something new. So silent aspiration occurs without obvious signs like coughing or choking, but may result in a drop in oxygen saturation. Recognizing subtle signs is critical for early intervention. And so you fed a patient an hour ago, and now they are desatting and their saturations have never dropped before. More than likely, food or fluid entered into their lungs. It did not go into their stomach like it was supposed to. And so you monitoring them, you allowing them to sit up after their meal is so important, because that will help to reduce the chances of them silently aspirating. All right. So during the state survey, if a surveyor asks you how you would perform a procedure, how should you respond? A, refuse to answer. B, say that everyone does it differently. C, refer the surveyor to the nurse. Or D, describe how you perform the procedure. Oh, when the state comes, everybody tries to hide. Oh my, you try to hide, but here comes the nice surveyor with her clipboard asking you a question. What do you do? No, Michelle, you can't refer her to the nurse. You're going to have to do D. You have to answer the question. Describe how you would perform the procedure. So, responding accurately about procedures demonstrates understanding and compliance with care standards. No, you can't go hide, and no, you can't go say, go ask the nurse. They asked you, the CNA. All right, so which department is responsible for preparing and dispensing medications in a hospital? Is it the pharmacy, environmental services, pathology, or psychiatry? Which department dispenses medications? Yes, everybody, it is a pharmacy. So the pharmacy department manages and dispenses medications as prescribed by healthcare providers. Next, what is a first step to take if Mrs. Davis begins coughing and shows signs of choking while eating? A, encourage her to keep eating. B, immediately perform abdominal thrust. C, stop feeding and allow her to cough. Or D, offer a drink to wash down the food. I'm over here smiling. You all I'm so proud of you. I am so proud of you. You all, anytime someone is coughing, that means that they are not choking. So we kind of use those words interchangeably. But if they are coughing, you don't have to perform abdominal thrust. If they're coughing, you want to do C. You want to encourage them to cough and, of course, stop feeding them. So if a patient coughs while eating, it's important to stop feeding and allow them to clear their airway. Performing abdominal thrust or offering a drink without assessing the severity could worsen the situation. So if they're coughing, encourage them to cough. When they can no longer cough, of course, you're going to hit that button, call for the nurse, but you're in the room with that patient. That is when you perform the abdominal thrust, which were previously referred to as the Heimlich maneuver. Next, if a physician requests a CNA to perform an untrained procedure, the CNA should respond by A, saying, I'll try it. B, attempting the task discreetly. All right, I'm going to do it. Just don't tell anybody. C, declining and seeking assistance from the charge nurse. D, completing it but not reporting it. Let's go back. I missed something. Yep. So Miley, you're right. If she's coughing, you encourage her to cough. You don't do abdominal thrust if someone is coughing. All right. So this one, I see all the correct responses. It is C. Sorry, doctor, I cannot do this. This is not within my scope of practice. So it's going to be C. CNA should not perform tasks outside of their training or scope. Instead, they should seek guidance from a supervising nurse. Maybe that doctor doesn't know that you're the CNA. Maybe they assume you're the nurse. They didn't read your tag. So you're going to explain why you can't do it, but go get someone who can. In long-term care, the CNA's role often includes A, clipping fingernails, B, assisting with daily activities and providing emotional support, C, diagnosing residents, or D, reporting directly to the physician. I see A's and B's and C's. You all are all around the alphabet with this one. All right. Dorviller want to make sure that I saw it. She put 2 B's. So now I see a whole bunch of B's. Haven't seen you in a few days, the Miller fam. All right, good to see you. So everybody, it is B, assisting with daily activities and providing emotional support. So no, you cannot clip fingernails. You don't clip anything. You can file, but you can't clip. And what was the other one you all chose? The other one was C. A CNA does not diagnose. Doctors diagnose. So the only thing that was within your scope is B. CNAs in long-term care assist residents with activities of daily living or ADLs and provide support promoting overall well-being. If a coworker begins talking about other residents in front of a patient, what should you do? A, change the subject politely. B, report the coworker to the nurse. C, encourage the patient to join in the conversation. D, continue working without comment. And I know a lot of you all are just going to do D, and you'll be like, Lord, I'd be glad when I go home. She gets on my nerves. But for your state examination and to protect your patients' confidentiality, what is the best response? It is not D. You all, you just can't go leave and tell the nurse. Remember, you have to communicate with people. So you're going to change the subject politely. Changing the subject is a respectful way to protect resident privacy and confidentiality in the healthcare setting. And then after you change the subject or attempt to change the subject, you can speak to that person directly. And then if that doesn't resolve it, of course, you want to speak to them nicely. That is when you would go to your nurse. So imagine someone telling on you about something you didn't even know that you did wrong. So they need to come to you first, and then hopefully that resolves it. And if not, that's when it can go further and be escalated by you telling the nurse. Okay, so you can't remove corns either, Mila. That is a podiatrist. That's not a CNA. We don't do anything that could cause an infection. So that's why you don't clip. All right, so and you also do not remove calluses. All right, so Mrs. Miller is going to a dermatologist but doesn't understand why. How should you explain it? A dermatologist treats mental health issues. B, a dermatologist treats nervous system issues. C, a dermatologist treats skin issues. Or D, a dermatologist treats heart issues. And everybody got it right. That is C. Dermatologists specialize in diagnosis and treating skin-related conditions. Which of the following should a caregiver avoid when providing oral care to a patient without a gag reflex? So this patient is in a coma. They don't have a gag reflex. Are you going to do A, using a suction device to remove excess secretions? B, ensuring the patient is positioned on their side? I'm sorry, which are you going to avoid? Excuse me. C, using a soft toothbrush to clean the teeth and gums. Or D, offering a sip of water to rinse the mouth. A patient without a gag reflex, which of these would you avoid? Vanessa Nardos Valua, I hope I pronounced it correct. Deline, I'm going to say Attracta because I don't want to mispronounce your name. Pam, Alice, Jerlene, Hayon, Chrissy, Vivalyn, the Miller fam, Jessica. Yes, you all get it right. And Flossie. It is D. A patient without a gag reflex may aspirate water if offered to rinse the mouth. So suctioning, side positioning, and gentle cleaning with the oral swab, the tooth that way you don't have to put a whole bunch of water in their mouth, are the safest options to prevent aspiration during oral care. And guess what? We are halfway done. But if you stayed this long, help me with the algorithm, friends. Go ahead and give us a thumbs up. Please share our videos with others. And I need you to subscribe so much and to turn your notifications bells on that I hit the bell twice on this slide. So go ahead and like the video. Please subscribe to our channel. And we thank you for supporting Florida Training Academy, Nurse Eunice, Phyllis. We just have, our team is growing. So we thank you all so much, and let us continue. All right, so if you missed your scheduled break by 15 minutes because you were busy on that floor, your best action is to A, leave for break immediately. B, ask another CNA to cover your task. C, check with the nurse before taking a delayed break. Or D, skip the break and keep working. You're welcome, Josette. What should you do? You were super busy and you're taking your break 15 minutes late. Yes, everybody, you are correct. You are entitled to a break, but check with the nurse before taking a delayed break because there could be another CNA that took their break on time. It's best to check with the nurse to avoid interrupting patient care and to ensure proper coverage. All right, so if you have questions about your assignment, who should you ask? Is it A, the medical director, B, the resident, C, the nicest nurse on the unit, or D, the nurse overseeing your assignment, even if she is not the nicest nurse on the unit? That's right, Chrissy. I know what you like to do. You like to try to bypass your nurse and go to your nurse buddy, but absolutely not. You have to go to the nurse who is assigned to take care of your patients. So it's going to be D. The supervising nurse is responsible for providing direction and clarification on assignments, not your favorite nurse buddy. A resident reports pain but doesn't want to bother the nurse. What should you do? A, encourage the resident to tell the nurse. B, notify the nurse immediately. C, wait until your shift ends to report it. Or D, ignore it since the resident didn't formally complain. Remember, who spends the most time with the patients? Who do the patients like most? It's not the nurses. So, everybody, the correct response is going to be yes, it is B. Notify the nurse immediately. Inform the nurse right away ensures that the resident's pain is addressed promptly, insurance enhancing their comfort and care. What they'll say is, I know the nurse is busy and I don't want to bother the nurse. You're not bothering the nurse by letting someone know that you're in pain because we don't want you just being in pain all day. So please, if they make a complaint to you that they've not told anyone else about, please go ahead and let someone know. All right, we're back to our breaks because I need you to get your breaks. All right, so if your break is postponed, what should you do before taking it? A, leave the unit without notifying anyone. B, ask another nurse to cover for you. C, confirm with the nurse that it's okay for you to take your break now. Or D, skip the break entirely because you're trying to get overtime and you're like, hey, I already missed it. I'm not even hungry now. I only got 4 hours left. Your facility is going to be so mad at you because they don't want to pay you overtime. And according to law, you have to take a break. So, of course, the answer is going to be C. Always check with the nurse to ensure patient care will not be interrupted. Next, team, what is the primary goal of palliative care? I don't even know what question we're on right now. We're probably like question 55, I think. So, what is the primary goal of palliative care? Is it A, correct behavioral issues? B, improve performance in daily activities? C, reduce food intake? Or D, provide comfort and relief from symptoms? Yes, Adiola. Yes, Dorvalier, Chrissy, Jutna, Jerlyn. Yes, you all have it. It is D. Remember, hospice is a philosophy. Hospice practices palliative care. So, what is palliative care? Palliative care focuses on comfort and quality of life for patients, especially those with serious or terminal conditions. What happens if, let me see, what happens if you're watching a patient for 24 hours? Do you take your break? So are you talking about like in a home care setting? That is different if you're in home care because you really can't take a break because if you take a break, your patient's left without anyone watching them. So you would have to, when the patient's sleeping, eat your food. But that is something you definitely want to speak to your agency about. But no, if you're assigned a 24-hour shift with a client, you cannot leave them. So if you're taking a break, you're taking it in-house, Vanessa. All right, so if a nurse assigns you an extra task, your best action is to A, ask another CNA to take on the task for you. B, inform residents that you're behind because of extra work. C, complete the task and then update the nurse. D, tell the nurse you'll complete it later if you have time. Vanessa, I didn't even know there is a such thing as working 24 hours in mental health. That doesn't sound safe. So that would be a facility I would avoid. That is my honest answer. You're getting 12 hours in a mental health facility from me, nothing more, nothing less. Maybe 16 hours, I'll do a double, but I would never work 24 hours without a break in a mental health facility. If you're tired, you are putting your patients at risk and you could lose the CNA license that you just gained. So everybody, for this one, yes, it is C, complete the task and then update the nurse. Complete an assigned task and informing the nurse ensures responsibility and good communication. If a nurse offers to let you insert a catheter to learn a new skill, your response should be, yes, I always wanted to insert a catheter. A, accept the offer to gain experience. B, refuse that it is outside of your scope of practice. C, perform the task, but shh, don't tell anyone. D, ask another CNA to assist. Let me tell you about Nurse Trudy. Nurse Trudy makes $75 an hour. And she's like, hey, Chrissy, come on over here and insert this catheter. I'm going to teach you how to do it. Be like, hey, Nurse Trudy, are you going to give me some of your $75 an hour? And she's going to say no. And so that's why you're going to do B, refuse, as it is outside of your scope of practice. Inserting catheters are not within a CNA scope of practice. So it's important to decline and maintain professional boundaries. Remember, when you're in the hospital and they take you through their PCT training course for free once you have your CNA license, that would be included in your job duties. They will train you to do that. It's not Nurse Trudy just training you on the fly so that she would have additional help to take care of her patients. All right, next, you observe a coworker experiencing back pain due to improper body mechanics. How should you respond? A, assist her with tasks involving lifting. B, ignore it since it's not your concern. C, suggest that she takes a pain reliever. D, offer to demonstrate proper mechanics. What do you do, everybody? I see so many correct responses. You all are absolutely correct. It is excuse me, D, offer to demonstrate proper body mechanics. Don't help her with all of her lifting because you have to lift your own patients. Demonstrating correct techniques can prevent further injury and promote safe practices among coworkers. And so Merlin wants to know how to measure the height of a resident who cannot get out of the bed. And so you're going to have the head of the bed flat, remove the pillow from beneath the patient's head, and you're going to have a measuring tape, and you're going to measure the patient from head to toe while they are flat in the bed. And that's how you would obtain their weight. So I hope I was able to answer that question for you, Merlin. All right, so before transferring a resident from a wheelchair to a bed, what should you check? Is it A, ensure both bed and wheelchair wheels are locked? B, make sure the bed wheels are unlocked and the wheelchair wheels are locked. C, leave both the bed and wheelchairs unlocked. D, lock the bed wheels, but leave the wheelchair wheels unlocked. Lord, that was a lot to read for all of those to be the wrong responses. So I know you all are super smart and you're going to keep anything that has wheels be locked. Ensure both bed and wheelchair wheels are locked. Locking both sets of wheels ensures stability during the transfer, thus reducing the risk of falls. I think I said A. I don't know. Let me make sure I said that right. It is A, everybody, not B. So you all are correct and I was incorrect. So it is A. I said the correct response, but I gave you the wrong letter. Right, so if a coworker places two residents together because they argue, yes, Jessica, a whole lot of nothing. If a coworker places two residents together because they argue, what should you do? A, ignore it since they're just socializing. B, separate the residents and inform the nurse. C, tell the coworker it's inappropriate but take no action. D, leave them together for entertainment. These patients will physically fight each other and hurt each other. So we don't want to put two people together who are arguing. Miss Nancy does not like Miss Paul. So don't put them together. It is not amusing. It's a headache. So you're going to do B. You're going to separate the residents and inform the nurse because this CNA, this tech is just causing nursing home drama, and we're not having that today. So it's inappropriate to encourage conflict among residents. Ensuring a peaceful environment is part of respectful care. All right, so if a wound vac or wound vacuum alarm keeps going off, what should you do? A, turn off the alarm until the resident is calm. B, reset the alarm and adjust the leg position. C, report the issue to the wound care nurse immediately. D, ignore the alarm, assuming it's a malfunction. So you got to think about a wound vac. What would that be for? It's alarming. What is an alarm for? An alarm is telling you that something isn't working. So this patient's wound vac is not working. So it is C. You have to report that. So the wound vac will not suck the drainage out of the wound if the seal becomes loose. So usually it's alarming to let you know, hey, something's wrong with the seal. It's not sucking anymore. So alarms related to medical equipment should be reported promptly to the appropriate professional for evaluation and action. And in most of your facilities, you only see the wound care nurse once a week. So you report this to your nurse, and your nurse will have to go in and then fix that wound vac, or notify the wound care nurse if she's unable to do so. If you find clothing mixed up with another resident's, think of long-term care where your facility is responsible for washing the resident's clothing. If you find clothing mixed up with another resident's, what's the best action? A, remove the clothing and report it to the nurse. B, ask the resident if it belongs to them and return it if they say yes. C, leave it and inform the family. D, ignore it and put the clothing back in the closet. Yeah, this one's a little tricky, but I see a lot of correct answers. I understand. I see A's, I see B's, I see C's, but you can't trust residents. You just can't be like, hey, is this yours? It won't be theirs. And they'll say, yeah, it's mine. So it's going to be A. You're going to remove the clothing and let the nurse know. This would now be the nurse's task to find out who owns it, and more than likely be placed in lost and found. And somebody would be like, hey, I haven't seen my black jacket. And they will go into that area and they will locate the black jacket. So reporting misplaced items helps to ensure residents' belongings are respected and properly accounted for. If a coworker hoards linens, oh, Miss Loretta, she gets to work early and she gets all the linens. By the time you get to work on time, you don't have any linens left for your clients or your patients. So what should you do? Is it A, report it immediately to the nurse? B, take the linens back when they're not watching. She's going to beat you up. C, address it directly with the coworker and report if needed. D, ignore it since it does not affect your duties. Ooh, I know the test answer, but in the real world, just probably get to work earlier. So the correct answer for the test is going to be C. Address it directly with the coworker. Hey, Miss Loretta, I know you get here early, but can you please leave me some linens? Addressing the issue respectfully with the coworker first allows for open communication before involving a supervisor if needed. And then Mila has a question about the wound vac alarm. So the wound vac alarm is going to beep whenever the actual, so I will say your homework assignment is just to go to Google and look up wound vac on a pressure sore. And you're going to see this black foam that is under a transparent dressing, which whenever someone has an open cavity in their body, that foam is going to help suck out whatever drainage and hopefully heal that wound. So it's preserving, it's increasing circulation, it's removing bad stuff. And so anytime that seal is released, the alarm is going to start beeping, beep, beep, beep. Anytime alarm is beeping, especially if it involves a medical device, you're not going to handle that. You're going to let your nurse be made aware. And I should say a medical device that's connected to a patient. So I hope that helps you to understand that one. All right, so next team, what is the first step the CNA should take if a patient makes an inappropriate sexual comment? Oh, you all are going to hear some of everything. Is it A, ignore the comment and continue providing care? B, avoid the patient? C, politely but firmly set boundaries and redirect the conversation? Or C, leave the room immediately and refuse further care? What do you think? What do you think? And you all are absolutely correct. It is going to be C. You can't talk to me like that, Mr. Lucas. I don't feel comfortable with this conversation. I'm going to change the conversation now. The CNA should address the behavior professionally by setting boundaries and redirecting the conversation. This approach maintains a safe and respectful care environment. Your patients cannot just say anything to you because they want to. You're going to set that boundary. If a resident not assigned to you requests assistance, what's the best approach? Is it A, report the request to the nurse immediately? B, ignore the request since it's not your resident? C, provide care, then notify the assigned CNA? D, help if it doesn't interfere with your assigned duties? What do you do? A resident asks for help, but they are not even assigned to you. Remember, everybody, you are responsible for everybody. So you're going to say, hey, how can I help you? I need a cup of water. So D, help if it doesn't interfere with your assigned duties. It's one thing if it's non-emergent. If it's emergent, you have to help. So, but at least addressing, hitting that call, like going in, patient's call, it's been 5 minutes. It's still showing that no one's entered the room. So assisting the resident when possible promotes a caring environment as long as it doesn't compromise your responsibilities. So at least go in, let them know that their CNA will be back shortly and that you'll check back in on them as soon as you finish doing what you're doing. And it's going to be easy for you to bring that person a cup of water and become their favorite CNA. Okay, so how should the CNA document an incident involving unwanted sexual advances by a patient? Ooh. A, use vague terms to avoid upsetting the patient's family. B, write a detailed, objective description of the patient's behavior. C, include personal opinions and emotional reactions to the behavior. D, avoid documenting the incident to protect the patient's privacy. And I think some of you are asking questions about the last one, so I'm not sure. Vanessa and Valua, if I'm correcting someone the first time, I'm not going to report it in the chart unless it's, something that violates me. But this time, I wanted sexual advances. I told this person to stop. I'm going to notify the nurse. Now they continue doing it. I am going to do B. I'm going to write a detailed document. So documentation should be objective. So it's not your emotions. It's exactly what happened. Detailed and factual, focusing on the patient's behavior without including personal opinions or emotions. This ensures accurate reporting for further action. And now if you still don't feel comfortable, this is where I would partner with my nurse to see if another CNA or tech can go in while I provide care to this patient. Regardless, the patient still has to have care provided, but I don't feel comfortable going in that room by myself. So I'm going to ask for assistance when I go in that room. And the nurse is also going to speak with that patient. And in most of your facilities, there's also security officers. So you do have extra layers to make sure you can provide your job safely and not feel threatened by somebody in their unwanted sexual advances towards you. All right, so if you observe a resident clutching their chest and breathing heavily, your immediate action should be to A, wait to see if the symptoms resolve on their own. B, help them to bed and report their symptoms later if they persist. C, ask if they've experienced similar symptoms before and offer water. D, notify the nurse right away and stay with the resident. Yes, everybody. Great job. You understand that it's D, notifying the nurse because immediate reporting is crucial when a resident shows signs of distress, ensuring prompt assessment and intervention. To ensure dignity when helping a resident with limited mobility during personal hygiene, you should A, complete the task quickly to minimize discomfort. B, request assistance from another CNA for efficiency. C, explain each step and encourage independence where possible. D, avoid eye contact to prevent embarrassment. How do you maintain dignity? Yes, Pam, Chrissy, Yuri, Nichelle, Jerlyn. It is C. Explain each step and encourage independence where possible. Promoting resident dignity involves explaining procedures and we're encouraging as much independence as possible. If a resident with dementia becomes agitated during meals, what's the best response? A, insist that they eat to ensure adequate nutrition. B, give them time to calm down, then reintroduce food gently. C, remove the food tray and try again at the next meal. D, ask another resident to encourage them to eat. Oh, this one's tricky. I like two answers for this one. But I think you all are right. I think it is B. So, yes, give them time to calm down and reintroduce the food. And don't forget, when you're trying to get someone to calm down, never tell them to calm down because that just makes it worse. So, try to figure out what the concern is, try to address the concern, but allowing a break to reduce agitation and then reintroducing food can help maintain a calm, supportive mealtime. Again, do not tell them to calm down because that is going to escalate the situation. If a resident's family member inquires about the resident's medical diagnoses, you should A, answer to the best of your knowledge. B, provide general information without specifics. C, politely explain that you don't have access to that information. D, direct them to the nurse or healthcare provider. And I am so proud of you all. I hope you're proud of yourselves. You all are doing so well with this practice test. I know it's 100 questions. I know you're probably watching TV, cooking breakfast, trying to work while trying to pass your test. And that's why I am giving you your kudos and your props, because I know it's hard to multitask, to do all of this, but you are doing it. And I'm so proud of you. So for this one, everybody, it is D, direct them to the nurse or healthcare provider, because medical information should be communicated by healthcare providers to ensure accuracy and maintain confidentiality. Someone told me that they were upset because their ultrasound tech wouldn't tell them what he or she saw. And I was like, that's not their job. Their job is to actually do the scan, because they can't tell you the treatment plan. They can't tell you if the mass is cancerous or if it's benign. So as a CNA, you don't have this extra information. So if someone's asking you a question and it's about medical information, you need to refer them to the nurse, all right? If you notice a resident's urinary catheter bag isn't draining and they appear swollen, you should A, adjust the bag to improve drainage. B, check for kinks, then leave if none are found. C, report to the nurse and monitor for discomfort. D, raise the bag to aid in drainage. All right, team, revealing the answer in 3, 2, and yes, it is B, y'all. They are swollen. That means that they are retaining urine. So reporting issues with a catheter is crucial for timely intervention and to prevent complications like infections. So if it was just that it wasn't draining, you could kind of release the kink, lift the leg. Maybe that's going to get it to drain. But this time, after you did all that, it isn't draining and the person's swollen. That's a medical emergency. This person is retaining too much fluid. So you have to get that nurse into the room. All right, this one. Which of the following is not a sign of dehydration in a patient? A, dark concentrated urine. B, dry mucous membranes. C, increased energy levels. D, poor skin turgor. Gail, I don't know when I go live. I have more team members now, so we try to go live like every day, but it's not like a set time. We run a full brick and mortar training business, and so it's really hard to schedule a time to go live because we have to actually service our clients that come to our building for CNA, CPR training, nurse prep, etc. So thank you for your patience. But if you have your notifications turned on, every time that we do go live, you'll receive a advance notice. Hey, new video alert. And then, of course, when we do go live, you'll get a notification on your phone. So I'm sorry, I don't know our schedule like that, but I do thank you for joining us today. All right, so everybody, the answer is C. That is not a sign of dehydration, increased energy levels. So dehydration typically causes fatigue, weakness, and lethargy rather than increased energy. Signs like dark urine, dry mucous membranes, and poor skin turgor are common indicators of dehydration. This one, a patient who is on fall precautions is found attempting to get out of the bed without assistance. Oh Lord, she about to fall on us. What is the first action the CNA should take? A, call for the nurse immediately. B, reposition the patient and remind them to not get up without help. C, assist the patient to sitting up and offer assistance. D, apply restraints to prevent further attempts. I know. I agree with you all. I think it's B and C. I think they both are right. They should have combined these two. All right. So if you chose B or C, I'm okay with either. All right. So C, assist the patient to sitting up and offer assistance and remind them not to get out of the bed without help. But they're going to get out of the bed without help. They're going to try again regardless. But safety is a priority. Assisting the patient to a sitting position ensure they do not fall while you provide help. Calling for the nurse can follow, but immediate intervention to prevent a fall is crucial. Restraints are only used as a last result and require a physician's order. So remember, if you're telling somebody who is confused and on fall precautions to not get out of bed, to not get out of bed, to not get out of bed, they're not going to remember it. They're going to do what they want to do. So most of your facilities will allow you to turn on the bed alarm, which whenever they shift their weight too much, the alarm will start sounding, which means you need to get into that room right away because it's saying that your patient's trying to get out of the bed. If a resident refuses their medication, this time think long-term care, think home care. Okay, they refuse their medication, where this person could independently take their meds. What's the most appropriate response? A, try to convince them of the medication's importance. B, document the refusal and inform the nurse. C, wait and offer it again later. D, leave the medication at their bedside. I don't really like this question. All right. But remember, if you're working at home care and you're working at some of these assisted living facilities and you are a seasoned CNA who took the additional classes, you can do medication reminders. So as a new CNA, before you take your test, remember you can't give medications, but once you have experience and you take those additional courses, you can do med reminders. So this patient refused their medicine. What are you going to do? If you chose B, document the refusal and inform the nurse, you are right. So document and reporting the refusal ensures accurate records and allows the nurse to address the resident's concerns. If you find medication left on a resident's bedside table, the best action is to A, return to the medication cart. B, remind the resident to take the medication. C, leave it in case they need it. Or D, report it to the nurse immediately. So there is just a pill sitting there on your resident's table. What should you do? You all, I am so proud of you. None of you all forced this person to take a pill that probably wasn't theirs. It is going to be D, reported to the nurse immediately. Reporting found medication to the nurse helps maintain medication safety and ensures it's properly handled. When assisting a visually impaired resident looking for personal items, the best way to help is A, move items within reach without informing them. B, offer help and ask where they like the items placed. C, leave them to give them privacy. Or D, encourage them to continue searching for the items. Well, D is just mean. The person already has a visual impairment, and you're just like, oh no, just keep looking for your glasses, Miss Lucas. You'll be fine. All right, so over here, we provide compassionate care, compassionate and competent care. So you're going to show some compassion, and yes, you're going to do B. You're going to offer to help look for the item. So assisting respectfully promotes autonomy while providing the necessary support. If you frequently help lift heavy patients, That means that they keep giving you the worst assignment, period. You did something. They say, oh, you're the good CNA. We're going to give you the hard patients. Are you going to do A, discuss task distribution with coworkers? B, refuse to assist since it's not solely your responsibility? C, request a lighter assignment? Or D, ignore the situation and continue helping? Do not get abused. Just because you are the strongest CNA, just because you are the most reliable CNA, does not mean that the one who is the least reliable gets the easier patients all the time. So yes, the response is A. All right, charge nurse, I need to have a conversation with you about task distribution. So discussing fair task distribution with coworkers helps to prevent injury and promotes teamwork. Preserve your back. Have a conversation so that you don't keep getting all of the heavy or hard patients. All right, so we mentioned JCO before. So during a JCO survey, a CNA should A, avoid interacting with the surveyors, B, demonstrate personal care tasks to the surveyor, C, focus solely on resident complaints, or D, continue doing their job and answer questions as needed. So JCO survey. We have the inspectors in the hospital. Yes, I see some correct responses. So don't go out of your way to demonstrate stuff to the inspectors, only if they ask. So it's going to be D. Continue doing your job and answer questions as needed. So CNA should conduct their duties as usual and be prepared to answer questions about personal care practices if asked. But don't go out of your way to try to be friendly with the inspectors, the investigators who are there. If they want to ask you a question, believe me, they will do so. When preparing for a telephone interview, it's best to A, assume the interviewer already has all your information, B, wing it since it's not face-to-face, C, find a quiet place and have information readily available, or D, skip preparation. So you finally got a call back from the hospital. This is your first choice. You didn't want to go work at a nursing home, and they're going to start off with a phone interview. How are you going to prepare? Everybody got it. It is C. Find a quiet place and research the hospital. If, let's say, you're interviewing to work on an orthopedic floor, research that department so you sound knowledgeable. Orthopedic patients have bone surgeries, joint surgeries. You don't want to be talking about heart attacks. Okay, so being prepared and having materials on hand ensures a more confident and organized interview experience. And we do have our practice interview video. It goes like over 25 questions where there's someone interviewing me and I am responding. So anytime you're ready to take your first or have your first interview, don't forget to go to Florida Training Academy's CNA interview questions video. And so it is in our playlist. A physiatrist, had to pronounce that, specializes in, is it A, mental health, B, rehabilitation, C, neurology, or D, nutrition? A physiatrist. I know that's not a term we use often. So this one is not psychiatrist, it's physiatrist. What does a physiatrist focus on? Yes, the prefix, the phys. Yes, you have it, team. It is B, rehabilitation. So a physiatrist are doctors who specialize in physical medicine and rehabilitation, helping patients recover their physical ability. So a psychiatrist focus on mental health. A physiatrist focus on rehab or movement. If you see a resident with stage 4 pressure ulcers, your best action is to A, document any care provided and no observations of drainage or bleeding. B, leave the ulcers for the nurse to document. C, only reposition a resident and ignore the ulcers. D, report it directly to the family. Ooh, this one. All right, now I'm seeing the correct responses. All right, so there we go. This one is A. Document any care provided and note observations of drainage or bleeding. Documenting observations helps provide accurate information for further medical evaluation and care. So a scenario I want to give you for this one is oftentimes when there's a new admission to the hospital or nursing home, the first person in the room is the CNA. So while you're turning this patient and repositioning this patient, you see a stage 4 wound. You can't act as if you didn't see it. When you document it, when you document the vital signs, you document the height and weight, you're going to document, you don't have to necessarily say the stage, but you need to document that the patient has a wound on their foot, a wound on their coccyx area. And now the nurse goes in whenever she comes in 20 minutes later, she'll come in and that's when she will do her full admission assessment. But you cannot see something and then not document it. And I think it was Mila who had a question about, can you work as a CNA with a visual impairment, as long as the patients can remain safe? There are nurses right now, or nursing students who have become nurses who are paralyzed. So we don't look at your inabilities as a reason to disclude you from being a CNA. You just have to work around your limitations. And as long as you can pass your CNA test, I'm sure that is somebody, a place where you will be able to work as with a visual impairment as a CNA. As long, again, as the patients are safe. So you're going to wear your glasses, use whatever you need, and then hopefully you will be able to complete the program, number one, but then number two, provide safe patient care. And I would encourage you to go to like community college or speak to a local CNA program in your city to see what recommendations they have for you to make sure that you can pass the skills and pass the computerized examination with a visual impairment. Maybe they can make the screen larger or provide you with an audio test that is read to you. Okay. Which of the following is an objective observation? A, Mr. George's oral temperature is 98.6 degrees Fahrenheit. B, Mr. George says he feels warm. C, Mr. George appears ill. Or D, Mr. George reported feeling feverish. Objective versus subjective. Medical professionals should not be using subjective observations. They should be using objective, what they actually see, what they actually hear, what they actually smell, what they actually obtain with instrumentation. So with this one, everybody, yes, it is A. All right, so objective observations are measurable and factual, like a temperature, as opposed to subjective statements. I hope you are so proud of yourselves because I'm proud of you. Who is responsible for addressing residents' complaints? Is it A, the social worker, B, the patient advocate, C, the charge nurse, or D, the medical director? Oh, by the time it gets to this person, that means that she has tried to work with y'all on that floor and y'all wouldn't listen. So that means that she had to go beyond the nurse. And she had to actually go and make a complaint with the administration in the hospital. And she is going to go talk to the patient advocate. So I'm happy that you all learned a new term. So yes, there are some disagreements that cannot be resolved on the floor because the nurse is the one who is making the patient mad or not doing what the patient needs. The doctor is not listening to the patient. So who does the patient go to when the medical staff is not listening, is not providing the correct care? They're going to go to administration and speak to a patient advocate. So patient advocates help resolve concerns and ensure the patient's voices are heard in healthcare settings. Remember that if you have a family member in a facility and you're having challenges with medical staff, they are not the last say. You can request to speak to a patient advocate. The ethics committee in a healthcare setting generally includes A, only physicians and chaplains, B, only hospital administrators, C, a multidisciplinary team including physicians, nurses, chaplains, and social workers, or D, lawyers and doctors only. Ethics committee. I'm happy you like that, Mila. Yes. All right, so here we go, everybody. I see Merlin. I see Chrissy. Yes, it is C, a multidisciplinary team. So ethics committees provide diverse perspective to address complex ethical issues in patient care. A major difference between working for a temporary staffing agency and a permanent facility is A, guaranteed shifts, B, the range of CNA tasks, C, less need for teamwork, or D, flexibility to accept or decline assignments. Because once you're a CNA with experience, baby, the doors are open for you. You can go work as an agency CNA. You can do travel CNA. Yeah, you can make some good money as a CNA. So, what is the difference between a temporary staffing agency and that permanent position at a hospital? Revealing the answer in 3, 2, and yes, you all have it. You have flexibility. You can say, oh no, I don't want to work today. Oh, how much you paying me for this shift? Oh, that I have to drive an extra hour. Do I get any additional pay? So temporary staffing offers flexibility and more pay in accepting assignments, unlike permanent positions which have set schedules. But don't try to go to these agencies until you have experience, because if you are receiving the most pay, then you're going to have the hardest assignment. So you need some experience first before you decide to be a traveling or an agency CNA. Which of the following is not a role of a registered dietitian? A, providing dietary counseling, B, developing weight loss programs, C, managing dietary department operations, or D, administering diabetes medications. All right, revealing the answer in 3, 2, and you all have it. A dietitian does not give medications. So, administering medications is outside of a dietitian's scope of practice, focusing instead on dietary counseling and nutrition management. A podiatrist specializes in A, foot care, B, eye care, C, physical therapy, or D, rehabilitation. What do you think the response is, team? And I see so many of you all who started with us over an hour ago who are still here. So I'm just happy. I'm elated. I just love the fact that you all love the study. So thank you all for being here. And yes, Yuri, yes, Vivian and Pam and Darlene and Odi Lugo and Yolanda, everybody, a podiatrist is the doctor you go to if you have a foot issue. So podiatrists are medical professionals who focus on the diagnosis and treatment of foot and lower extremity disorders. Great job. The professional way to answer the phone at a facility is, hello, Sunshine Senior Care Center. This is Gina. How can I help you? So is it A, or is it B, hi, this is Gina? Or is it C, hello? Or is it D, this is Gina? Don't be C or D. So everybody, the correct response is A. All right, you want to indicate the name of the facility. Maybe it's your unit. Hello, 3 Central. This is Nurse Eunice. How can I help you? So that the person knows where they are calling. So stating the facility's name and the speaker's name provides clarity and a professional greeting. Which of the following is a legal responsibility of a CNA? Is it A, supervising other CNAs, B, teaching other CNAs, C, mentoring other CNAs, or D, none of the above? Ooh, I don't care what you see in your facility. I need you to pass this test. And according to the state, a CNA does not supervise, mentor, or train other CNAs. According to the state, a nurse does all of that for the CNA. So the correct response is D. I know what happens in your facility, but you have to pass this test and answer it correctly. So CNAs are not authorized to supervise, teach, or mentor other CNAs, according to the state. They focus on providing patient care under the supervision of a nurse. If asked to oversee a nursing home for the weekend because you are just that good of a CNA, It's like, hey, you know what? We don't have any nurses to cover this weekend. We need you to cover. What should you do? A, request clarification. B, do their best. C, decline the assignment. Or D, contact the facility owner. We're really in a bind. We could really use you. We'll pay you an extra $20 per hour. We just need you to supervise, to answer the phones. If something goes wrong, all you got to do is call 911. You're going to jail. So how do you prevent from going to jail, you all? Yes, Hayon. No, that's not within your scope of practice. You're going to decline the assignment. Being in charge of a facility exceeds the CNA's responsibilities. Y'all like, look, I'm going to ask for clarity. Hey, can you clarify what you mean by that? No, I'm not going to jail with y'all. Y'all need to go hire a nurse, which are limited to providing direct care. So yes, they're going to try you, especially if you're a good CNA. But if you mess up your CNA license, you are not going to get a nursing license. So protect your CNA license. They're going to try to get you to do additional things. Tell them or ask them, hey, I see that you're really trying to give me these additional duties. What type of tuition reimbursement do you have so that I can go to nursing school, so that I can really help you? Because I see that you're, struggling to have nurses that want to, do the work the way you want it done. So that's how you get your tuition paid, since they like you so much. And then you can work with them as a nurse in the same facility that you worked in as a CNA. So next one, which of the following task is within a CNA scope of practice? Is it A, taking a newborn's temperature, B, starting an IV access, C, clipping toenails, or D, none of the above? So if you've been here during this whole video, I already gave you one of those answers, or at least two. So which is within a CNA scope of practice? And I see C's, I see D's, I see an A. All right, none of the above. All right, you all do not work with newborns. You're not in a NICU. You're not going to be in there putting a thermometer in the baby's bottom, because you could perforate. So CNAs typically don't work with newborns and are generally not permitted to perform invasive or high-risk tasks like starting IVs or clipping toenails. Remember, you can file, but the person who clips or shaves or removes corns is not even a nurse. It is a podiatrist. It is a foot doctor. So none of those tasks were within the scope of practice for a CNA. CNAs are personally responsible for A, patient outcomes, B, ethical actions, C, administering medications, or D, diagnosing conditions. What are you personally responsible for? Revealing the answer in 3, 2, and finally got it. It is B. Let's see what Milo says. Oh, I thought CNA is going to work over the weekend. I guess that's, no, Milo, you can work over the weekend, but what you can't do is supervise a facility over the weekend. You don't supervise anybody. So I think that question is referring to supervision, not just working. So, but for this one, everybody, it is B. You are not responsible for the patient outcomes. You are responsible for your own ethics, such as using social media wisely within the facility, not sharing patient information online, not accessing charts or information of patients that are not within your direct care. So CNAs must act ethically within their scope of practice. They are not personally responsible for patient outcomes or medical diagnosis. Remember, the entire team is responsible for the patient outcomes. And as far as medical diagnoses, that would be a physician's job. If a CNA walks a patient through a wet floor area and they fall, who is responsible? Oh my God. Is it A, the CNA, B, the employer, C, the facility administration, or D, the patient? I'm just over here shaking my head because I cannot believe you walked the patient through an area that said wet floor and the patient fell. Imagine how the patient's going to feel, the family member's going to feel. the nurse is going to feel and how you're going to feel when I write you up. It is A, the CNA. You are responsible. So the CNA is responsible for resident safety and should avoid areas that pose a risk to residents. Another question about your responsibilities. If a CNA fails to lower a patient's bed and they fall out, who is responsible? Is it A, the CNA, B, the patient, C, the facility administrator, or D, the employer? Why did they make you go to class? Why did they make you take a test? Why did they make you get a license? Because you, my dear, can be sued. All right. So it is A, the CNA. So make sure you're performing your job well. All right. So it's the CNA's duty to ensure bed safety, and failure to do so may result in direct responsibilities for injuries. Sharing patient information with unauthorized individuals violates A, patient autonomy, B, HIPAA regulations, C, standards of care, or D, the Nurse Practice Act. I'm so proud of you all. Yes, yes, yes. HIPAA. So HIPAA regulations. So HIPAA safeguards patient privacy, and unauthorized information sharing is a violation. Every time you access an electronic record, medical record, your login information is attached to that record. So if I know that there's a celebrity in the hospital and I try to be nosy and I pull up the celebrity's information, it is now time stamped that, Eunice went into this record at whatever time it is, 9:52 a.m. on November the 16th, 2024. And now when they go back and they check because there was a data breach or someone said something about this patient being in the hospital and they see that Eunice wasn't assigned to that patient, I could lose my nursing license. So you have to be very careful about protecting the rights, even if it is an individual, a celebrity, maybe it's something you saw on the news and you just want to see how this person's doing. If it's not your patient, you should not be looking them up. We have a total of 100 questions, and I think we only have about 4 questions left, Vanessa. So standards of care inform CNAs about A, detailed procedure steps, B, relevant state laws, C, nursing scope of practice, or D, minimum actions to ensure safe care. Standards of care, what does that tell you? And if you chose D, minimum actions to ensure safe care, you are correct. So standards, bare minimum of care, established a minimum expected actions for safe and effective CNA practice. Oh, I'm gonna do a video later this week. Don't ask me when, because y'all know I don't know, about vitamin deficiency. So a patient with prolonged bleeding after a small cut may have which type of vitamin deficiency? Is it vitamin A, vitamin C, vitamin K, or vitamin E? Ooh, I'm so proud of you. I see so many correct answers. Woo-hoo-hoo. All right, I'm just way too happy about this. If you chose C, vitamin K, give yourself applause. So vitamin K is vital for blood clotting. A deficiency can result in prolonged bleeding. Good sources include leafy green vegetables like spinach, kale, and broccoli. All right, negligence occurs when a CNA, A, fails to perform a necessary duty, B, turns a resident Q2H and PRN, C, assists with toileting, or D, provides excellent care. Oh, look how I threw that acronym in there. So after you give me the correct answer, tell me what those 2 acronyms mean or medical abbreviations. So which of these responses indicates negligence, and what does Q2H and PRN stand for? Yes, everybody, you chose A. Great job. What does Q2H and PRN mean? All right. Q2H means every 2 hours. And what does PRN mean? See if anyone can type it in. What does PRN mean? Yes. So Q2H, Q is every, 2 is the number, and then H is hour, but PRN is as needed. So that wasn't a correct response, but I just want to make sure I started throwing some terminology in there. So the correct response is A. If you fail to perform a necessary duty, such as turning your resident Q2H and PRN, that would be a sign of negligence. So negligence involves failing to perform a duty leading to potential harm to your patients. And let me remove that. Sorry, I did something there. I can't remove that right now, so sorry about that. All right, so what is a CNA's top priority when caring for multiple patients? Is it A, time management, B, self-determination, C, safety, or D, respect? Yeah, Nichelle, this one was tricky because your top concern never involves you. Your top concern involves that patient. And the reason for the CNA exam is to ensure C, that you are a safe caregiver. So safety is the correct response because patient safety is a primary concern as it prevents harm and ensures well-being. So time management is nice, but being a safe provider is the priority. Another vitamin question. Which nutrient is essential for calcium absorption and preventing bone disorders such as osteoporosis? Is it A, vitamin C, B, vitamin D, C, vitamin B6, or D, vitamin K? What two things must go together? Yes, Yuri and AJ and everybody. It's a lot of you all. Shelda and Blessing and Chrissy and Pam. It is vitamin D. It is B. So, vitamin D helps the body absorb calcium, which is crucial for strong bones and teeth. Sources include sunlight, getting your butt out the house and going outside. Fortified milk and fatty fish like salmon will improve your vitamin D levels. You all, I think we made it to our last question. A patient has symptoms of fatigue, pale skin, and a sore tongue. Which vitamin deficiency might be responsible? Is it vitamin A, vitamin C, vitamin B12, or vitamin D? Fatigue, pale skin. All right, we'll reveal the answer in 3, 2, and Pam and Karen. I said Karen, I think it's Chrissy. All right, I think Karen did it too. Yes, it was Karen. Great job. So that person's anemic. So C, vitamin B12 deficiency can cause anemia, leading to fatigue, pale skin, and a sore tongue. This vitamin is essential for red blood cell production and neurological health. Sources include meat, fish, eggs, and dairy products. You all, I don't know when I'm back again. I think Phyllis will be on Tuesday. I know I have a busy week. That's why I spent time 2 hours today going live with you all because I love you. I appreciate you. And I want to see you succeed in everything that you do. So you all, this is Nurse Eunice. I will stay around for like an extra minute to see what questions you have. But if you stay this far and you haven't liked the video, you haven't shared the video, you haven't gone to our website, fltraining.com, and clicked on resources and downloaded something free, a study guide, anything, please do so now. And so I don't know when I will be live again, but Phyllis and Saskia will be live again earlier during the week. So let's see what questions you all have. Oh, you all are so welcome. And I am going to be taking my son to the fair. So we have about 1 more hour to get up and get out of this house. So I don't see any questions in the chat. I love you all, and I hope to see you again. For me, it probably won't be until Wednesday, but if I get an opportunity to come on before then, I will do so. You all take care and have a wonderful weekend. Thank you for studying with me.